Hey everyone, Tony D with another hot take. This one, we're going to talk about the coronavirus, but not just the virus, but the political implications of the virus and what the fallout from it may be. So, as of now, it sounds like the virus, oops, sorry, low battery. The virus is pandemic levels in the states. The state of Washington has declared a state of emergency. I believe New York State is about to declare one because New York, there's a bunch of cases there. Philadelphia just got its first case. On the upswing, the negative thing in Washington is an old folks' home was infested by the coronavirus, a couple of patients there. But the upside is allegedly from the Chinese government, they were able to cure a 98-year-old woman of the coronavirus, which is very good news, especially for these people in Washington who just got sick. However, another bit of good news is the one case in New Jersey turned out to be negative. However, it could be like the case in San Diego where the woman tested negative. 2 days later, she came back and she had it. So, odds are, the way this thing's spreading, everybody's going to get it. Everybody meaning, according to experts, something like 40 to 70, 80% of the population. So roughly, I would say half or more. You got to figure like 50, 60% at least. Everybody's just going to get sick. And so you got to look at your place of work and wonder, can we keep this place open with like more than half the people being at home sick? And they're going to be out for at least 2 weeks. And part of the problem is some of these cases will be mild and people are stubborn and they'll still go to work and they'll still go out and the coronavirus will be everywhere. So I think it's going to be very hard to get a lid on this. I mean, if this virus can survive on surfaces for 9 days, how do you prevent someone who's, just not thinking straight, feeling awful, they're out of medicine, they have to go to CVS or someplace to get medicine, they germ up the whole place. Right, Joan? Right, Joan? Yeah, they're going to germ up the whole place. Then healthy people are going in, or people who, they might be sick or they're freaking out, whatever. They touch the surfaces or they shop there. They touch the surfaces, boom, they got it. The employees get it. It just spreads and spreads and spreads. It's very contagious, this thing. So I don't know how they're going to get a lid on this other than eventually everybody gets it and eventually there's an immunity. Or we hit the spring and the temperatures are so warm, the virus just dies out mostly in the warmer places. Here, it's been unseasonably warm through most of the winter, and especially in February. Today was 61 degrees, which is still pretty warm for early March in New Jersey. So figuring that you're basically going to have like a month of people being out of work, sick. It's not going to be the same people, but it's going to like be over the course of a month or so. You might have businesses closed for a while, because there's just no sense of keeping a business open if there are no customers and half the employees are sick. So that might usher in a recession, at least a small one. So that's going to hurt Trump going into the election. Of course, the Democrats are already trying to take advantage of the coronavirus by saying, oh, Trump's response was terrible. Making Mike Pence in charge of it was dumb and blah, blah, blah. I don't know if they got much traction there, but they're certainly going to try. That's going to be their latest tack. But the bigger news will be overseas. China was pretty devastated by this virus, and it's unknown the true death toll there, because unlike certain parts of China are pretty sophisticated. They have medical facilities comparable to ours, but keep in mind it's a lot of people, and some people still live in villages in China, and it's not super primitive, but it's not super up to date, and they don't have access to medical facilities, and because they have such an oppressive government, a lot of people are trying to hide the virus. So the death toll there we'll probably never really know, but it's probably much higher than the Chinese government would let on, or much higher than, say, in the United States, where basically everyone will get some kind of treatment. So that could potentially destabilize their government. Iran could potentially be destabilized as well, because the guy in charge of talking about or curbing the disease, he actually died from the coronavirus. He was the guy who was on camera. He was sweating. He didn't look so good. Turned out he had the coronavirus. He infected everybody at the press conference, and he died a short time later. So that doesn't bode well at all for Iran. This could mean a big shakeup, especially if it goes through the hierarchy of the bigwigs there, and maybe a bunch of them die. Maybe somebody sees it as their opportunity to seize power. Could be a shakeup there. In North Korea, they actually shot one of the first guys to get the coronavirus, which is crazy to me, but I guess that's one way to corral the virus. Perhaps we'll definitely not know how many people will die of the virus there. I mean, if it gets into the population there, I mean, forget it. It's just going to run rampant until everybody has it, and a significant, not significant, but a 2 to 5% portion of the population dies. I think, they'll just die through lack of care, lack of access to, drugs and whatnot. I think, the Chinese are taking advantage of the disease. They can purge their country of some of the people they've been looking to purge, like the Uyghurs, and just say, oh, well, they all died of the coronavirus. So, it's a little bit different. At some point, there may be a new mutation of this disease, and it may be the sort of mutation that everybody just gets and it doesn't hurt you, or you just get a runny nose and then you're fine. And so it may die out like that. A lot of times that's what happens to the flu or SARS or any of these other ones. You actually have some of these antibodies in your system simply because the disease, the virus itself, is passed on, but it's so weak by the time it gets to you, no biggie. But this coronavirus seems very contagious and very strong. So I'm not sure that's going to happen, but you don't know. I mean, you can't tell with these things. It could go the other way. It could kick up and suddenly get very deadly, and suddenly people just start dropping like flies. That seems even less likely the way this is going, but we're still waiting for a moment for the whole thing to plateau, and it's a little hard to count because China's numbers are probably a lie. There's probably way more people that have the disease, a bunch of people they killed who they're attributing to the disease or not telling anyone about it. Just can't trust anything coming out of a communist country, especially China. So take the information with a grain of thought. Now, salt. You have to look at the numbers from the States and other countries, and quite frankly, those numbers aren't that high yet. So hopefully, there's a chance we can contain it, but it seems unlikely the way it's spreading. And it seems unlikely because it spreads so easily. The Pope has it, or he's sick. I'm not sure he has the coronavirus. I don't think he's been diagnosed with that, but he is sick. So that could be a big deal if he dies. That could, hugely impact the Catholic world, which is a lot of people in South America, a lot of people around the world, really. But South America in particular could just bum everybody out. I don't see too many other countries being destabilized by this. Maybe Venezuela. if it gets rampant down there, because they're in dire straits. Possibly Cuba, but they're on an island, so there's a good chance it won't even get to them, because they are pretty isolated. Not super isolated, but isolated enough that, the coronavirus might not make it to them. And they're in a warmer part of the world, where viruses, they're definitely not going to survive on surfaces very long in a hot spot like Cuba. So maybe we just have to hunker down and wait for this all blow over. I don't think in the long run this will be a big deal. I think by the time we get through the summer, the coronavirus will be a distant memory. It'll be like, well, that really sucked. A lot of people died, but it's over. And then maybe the world community. I think one of the things that might happen is the UN and the community at large, worldwide, might come down heavily on China for their handling of this. Now, initially, the World Health Organization praised China for their handling of the virus, but now things are starting to come out, things that they lied about. I think a lot of that's going to come out, and I think we should come down pretty hard on China, at least in our rhetoric. I mean, I'm not suggesting a military thing, but I think the world community should, go to China and be like, hey, we're not giving you any more diseases to experiment with. Because keep in mind, they got these diseases from China or from Canada in order to have this lab and do experiments or whatever. I think there should be some sort of punishment, and one of those punishments should be that China should be pressured to shut down their level 4 lab and completely dismantle it, scrub it down, destroy all their viruses, and not pursue this kind of research until they can prove that they can handle it, or they build a new facility out in the middle of nowhere, very isolated, not in the middle of a city, where people could go outside and then suddenly start infecting the population. How about that, China? At the very least, that should be done. If not, I'm not a big proponent of sanctions, but I hardly think that would even work against China. But something should be done. The world community, the UN, someone, should pull people together and say, hey, China, get your act together. And definitely we should not be handing deadly diseases over to the Chinese scientists to experiment with. I think that's a lose-lose proposition. I don't know what possessed Canada to give China, a communist country that's fairly hostile to the West. I mean, they're not openly hostile, but they're kind of hostile to the West a bit still. Why would you give them deadly diseases? This seems to be a poor choice. Joan, do you want to say goodbye? I'm ending this video. You want to say bye-bye? Come here. Well, Joan does not want to say bye-bye. I'm very sorry. All right. Well, that's it from me. We'll see you next time. Remember, keep washing those hands and wear the face mask anyway. Don't listen to the news. I'm sure it does something.